Renal tubular acidosis, or RTA, is a group of disorders in which the kidneys cannot maintain the body's normal acid-base balance. Although the kidneys filter blood normally, they fail to remove acid or conserve bicarbonate effectively. This results in a normal anion gap metabolic acidosis and can lead to growth problems, kidney stones, and bone disease if left untreated. Healthy kidneys keep the body's pH within a narrow range by reabsorbing filtered bicarbonate, secreting hydrogen ions, and generating new bicarbonate. Most bicarbonate is reabsorbed in the proximal tubule, while the distal nephron performs the final acid excretion. Any defect in these processes can cause renal tubular acidosis. There are three major types of renal tubular acidosis. Type 1, or distal RTA, occurs due to impaired hydrogen ion secretion in the distal nephron. Type 2, or proximal RTA, results from defective bicarb reabsorption in the proximal tubule. And type 4 RTA is caused by aldosterone deficiency or resistance, leading to reduced acid excretion and elevated potassium levels. Now, in distal RTA, the kidneys cannot acidify the urine despite the metabolic acidosis. Patients often have a urine pH above 5.5 and low potassium levels. Common causes include autoimmune diseases, medications, and chronic kidney disorders. Complications include kidney stones, nephrocalcinosis, and bone demineralization. Treatment focuses on alkali replacement and correcting hypokalemia. Now, proximal RTA occurs when the proximal tubule cannot adequately reabsorb the bicarbonate. Initially, bicarbonate is lost in the urine, but as bicarbonate falls, the urine may become acidic again. Causes include Fanconi syndrome, certain medications, and inherited disorders. Patients may develop rickets, osteomalacia, or growth retardation. Treatment requires bicarbonate supplementation and management of the underlying cause. Now, in type 4, which is the most common form in adults and is associated with low aldosterone activity or resistance to its effects. Unlike other types, it is characterized by high potassium levels or hyperkalemia. Diabetes, adrenal disorders, and medications such as ACE inhibitors or potassium-sparing diuretics are common causes. Treatment includes addressing the underlying conditions and controlling the potassium levels. Now, to summarize, all forms of the renal tubular acidosis produces a normal anion gap metabolic acidosis, but they differ in their underlying defects at the potassium levels. In type 1, causes impaired acid secretion with hypokalemia. Type 2 causes bicarbonate wasting with hypokalemia, and type 4 results from aldosterone deficiency or resistance with hyperkalemia. Early diagnosis and appropriate treatment can prevent kidney disease. It can prevent kidney damage, bone disease, and long-term complications. Now, understanding the different types of renal tubular acidosis helps clinicians diagnose the conditions accurately and initiate timely treatment to improve the patient's outcome. For more evidence-based medical tips and clinical concepts, don't forget to subscribe to my channel and turn on the notification bell so you never miss any update. Thank you.